Hi everyone, welcome. Hello. We're just going to wait for a few people to join, but so nice to see so many lovely people. Hi. Hope everyone's enjoying the spring sunshine.
Yeah, it's lovely.
Yeah, I'm feeling su in such a good mood.
Good.
We're just literally going to give it. We're going to start at about 4:19, so we're going to give a couple more minutes so people can join, and then we're going to power you through this amazing new launch um, for Omnilux with the incredible Dr. Ablon, who I've got a bit of
Very ready.
a girl crush on. I think she's amazing. Um, yeah.
What
So
time is it
I have
Central there?
even though I don't have a sort of oily skin and have breakouts, I have been trialing this product so I can talk knowledgeably about it. And these products, I should say, and they are phenomenal.
And
Um,
you know, we
I don't know
just
if any of you
completed.
have tried the products yet. Anyone? No? Okay. You're in for a treat.
We
Right, we're
just
going to give it
completed
one
a.
more minute. Oh, I think we have actually. I think we can pretty much start because we've up to 25 people. We're just going to give it till 19 and then we're going to start.
Can you hear me?
I can
Okay.
hear you. Can everyone
Just
hear us? Are we
yeah,
all good?
just we just literally just completed, and I just got the statistician's papers from our Omnilux study where we actually did a clinical trial, which is always nice to see, on patients with acne just using the mask, and the results were phenomenal.
Amazing.
Really excited to share.
Well, anyway, I think we're more or less all here now. And I just want to say good afternoon, everyone, and welcome to the launch of the new Omnilux Clear Rescue range, a simple, innovative, and highly effective routine formulated to work in synergy with and to optimize the results of the Omnilux Clear LED mask. Talking us through the key ingredients today, and acne symptoms and solutions, and much more, I'd like to welcome you all and introduce Dr. Glynis Ablon, board certified dermatologist, founder of the Ablon Skin Institute and Research Center in Manhattan Beach, California, and associate clinical professor of UCLA. That's quite the credentials, Dr. Ablon. Just a few little housekeeping rules. If you have any questions for Dr. Ablon, please type them in the chat and I'm going to put them to her at the end of the session. Dr. Ablon will also be available for further comment and the Omnilux team will share her details. And just a reminder to everyone that June is Acne Awareness Month. So these are very topical products that we're going to discuss. I know you're super busy, so we're going to keep this short, sweet, to the point, and you can get on with your busy days. But Dr. Ablon, welcome. You're in California right now?
How sunny California, bright and early in the morning, 8:19.
Thank you so much for getting up early for us. There is no one better qualified to discuss blemishes and breakouts than you. So I wanted to kick off by asking you, what is exciting you most about this new trio of products? And I'm going to show you the products here. This is the trio. We're going to go through them one by one.
Yeah, so I think it's important to understand that acne is a multifactorial etiology. And you have to remember that you're not just treating one thing, you're treating multiple things. And what's exciting is this new product line has many different ingredients in each of the products that work in a different way. And when people get acne, sometimes they can get to a dermatologist, but not always. And sometimes it's cost is prohibitive or timing is prohibitive and or their insurance doesn't cover it. So it's really nice for people to be able to find a line that's available that you can order yourself. You can try the ingredients. There's nothing in there that's irritating and too aggressive. So it's very safe on most skin types, all skin ethnicities. And so again, really nice product that you can use, you can try, and oftentimes people are getting great results. And when you pair it with the mask, for me, as I said, that mask is everything. I mean, I walk around the house with my face mask, my neck mask, my hand mask. So to be able to have a device at home and to be able to have topicals at home and have them work synergistically together is fabulous. Now, of course, you're going to have those few resistant cases or more severe cases. And if you're not really doing fantastic, you want to see your dermatologist. But again, they've created this line that really does work and helps the majority of individuals with acne that's, starting out. And again, we all have stress in our lives. And I think COVID has only made things worse in the last 5 years. And so stress also increases your breakouts. And so anything that you can do at home, knowing that you're helping your skin, I think reduces your stress, which means your acne gets better as well.
And I think another thing to say about this is the simplicity of it, right? I mean, in a world where we're presented with so many choices, this is a three-step routine, and you can get this done like in 2 minutes, right? I mean, it's just super, super simple. My first question to you is, I'm the mother of two teenagers. Well, my younger is about to turn 13, and they are really overdoing it with skincare. Is this range suitable for teens, for teen acne?
That's a very good question. And we're seeing so much of these individuals now, piling on multiple things. And the more you do, actually, the more you hurt your skin. So we have to understand that when we're putting products on our skin, there's a gut, brain, skin connection. Okay. So it all ties together. So you have to keep that in mind. So I do say you are what you eat. So the healthier those teens eat, the better their skin will be as well. They've in the past, we've said, oh, there's no connection between diet and acne. That's absolutely been proven false. And we know that what you put in your body does reflect on your skin. And that relates to psoriasis, eczema, arthritis. I mean, many different conditions can be improved with diet. So I always say start there. But then for the teens, it's keeping it, I say, really keep, the kiss, keep it simple. And I don't want to say stupid, but keep it simple. And the idea again is these are products that are safe. You want to make sure that you are not ruining the skin barrier. That's a big part of it. That's what I love about squalene. There's a moisturizer that has squalene in it. It's one of my favorite ingredients because you want to make sure when you're putting things on your skin, you're fighting, the main things of acne. You're fighting the bacteria that live on the skin. You're fighting the secretions of the skin, the oiliness and glands of the skin. You're fighting the what's called the cell turnover. And so people that have that, you lose me?
No, I think if Christine, if you could just mute that, thanks. Yep, go
People
ahead.
that have acne, their skin cells don't turn over like it should, and that's where things that will help shed the skin, the kind of mild acid, salicylic acid, things like that. So you want that cell turnover. But in that process of attacking kind of those main things, and the last one, of course, is hormones, which we don't have great control over other than different kinds of oral medication. But when we're trying to attack those three factors, we also want to make sure that we're preserving that skin barrier so that we're not then increasing the risk of infection and other things that can happen. So they created this nice, complex, simple routine. So again, less is better, that you can clean your face, apply a product, and moisturize. And it really is straightforward. And yes, it is very safe for teens. I do say that if you have someone that has really sensitive skin, oftentimes just to be safe, I will have them do a little test spot, either right in front of the ear or even on the wrist, just to see how their skin responds. Because every once in a while you'll have someone that is just extremely sensitive, and the last thing you want is a reaction.
Okay, great. So this is a range that's suitable, new acne range that's suitable for teens and for, let's say, menopausal or hormonal acne in adults. And I think we should start by running through the products one by one. So first of all, I want to introduce you guys to the Omnilux Salicylic Acid Cleanser. Now, I don't have oily skin. In fact, I have dry skin, but I have been using this, and it's a lovely foaming cleanser. I'm going to show you guys here. It's very gentle, but it gets the makeup, everything off. And I love it because it's non-scented. Dr. Ablon, can you just talk about some of the ingredients that are in this gentle formula? The niacinamide, the licorice root, and why they're good.
Yeah, so niacinamide is being put in almost everything, and I love it. And I think it's a great ingredient because it's anti-inflammatory. So it's a great thing to add to anything because it's going to decrease inflammation. So of course, in acne, we want to decrease inflammation. That's number one. Number two, it's got two different kinds of acids in it. It's got the salicylic acid, which is a beta hydroxy acid, which is an acid, again, that turns over cells with less irritation. So it's not like a glycolic acid, which can burn on your skin. It doesn't do that, but it does help with cell turnover. But they also add mandelic acid, and mandelic acid is one of my favorite little gems. I think it's just one of the best acids out there. It's a very large weight molecule, so it actually provides moisture to the skin and actually protects the barrier and smooths the skin. So it's a really great ingredient. I think that little combination really helps. Licorice root is great. What's interesting is licorice root is actually used for pigmentation. So if you know, and I just spoke at the American Academy of Dermatology on this, but acne is one issue. Acne sequelae is a whole nother issue, and that's the post-inflammatory erythema, post-inflammatory hyperpigmentation, and scarring. And so when you put something like licorice root, you're helping with the pigmentation that can happen after people either pick or they just get a residual mark after the acne is there.
And am I right in saying that mandelic acid, does it come from almonds?
Mhm.
Okay, interesting. Okay, so moving on, you've cleansed your face, and the next thing you're going to do is you're going to put on and we've been debating, is it noni or noni, depending on where in the world you are, balancing serum. And again, this is like a non-scented, lovely, I mean, the textures of these products are phenomenal. It kind of literally, it just sinks like hot butter on toast into the skin. What is noni or noni?
So, and I like noni because I always think of no acne. So that's
Yeah.
why, but so that's what I mentioned, that squalene. So squalene is one of my favorite ingredients. It really does act as a moisturizer, as an emollient. But it kind of sits on the skin and protects the skin. So it creates that kind of like a barrier. They've also added the niacinamide, also again anti-inflammatory, and then they added oat kernels. So oat kernels, I will tell my patients with eczema or any kind of rash to take a soaking bath in oatmeal, but oat kernels are anti-inflammatory and they actually will soothe inflamed skin. So they work really well in combination, again, to just kind of.
Is noni an Australian berry? It's a botanical, I think, from Australia or
Might be
somewhere.
right. You might be
Yeah,
right. You might be
very
right.
antioxidant, I
Yes,
believe.
yes, yes.
Okay. I have seen it in some other skincare products, so maybe it's kind of like an interesting new ingredient to write about. Um, and the third product we have here, the final product, this is actually, before I go on to the final product, sorry, this noni serum, you can wear this while underneath your mask. You should wear this with your Omnilux clear LED mask. Um, does LED light dry out the skin?
So anytime you're doing a treatment, you are changing kind of the surface of the skin. And so while it's not meant to quote unquote dry it out, people
Mhm.
can feel like they are a little drier after a procedure. So I tell them, and that's why I think it's great because you can actually apply this on the skin, moisturizes the skin, and actually gives you hyaluronic acid in it as well to create moisture. And then while you put that mask on, it's not blocking the mask from getting to all those little sites that it wants to get to, but it does help just make the skin feel better.
Are there any ingredients or any products you should absolutely avoid while doing LED masks?
So the only big thing I say is retinoids, anything in
Hmm.
the retinoid family.
Okay.
Remember, LED is not ultraviolet light, so it's not quite the same. Like when we say that retinoids are sun sensitizing, because this is not sun, it's not
Huh?
sunlight. But I don't tend to do it because, again, those products are very drying and there's just kind of no way around it. They are drying. And so I don't like to put that on, certainly not before using a mask. And I warn people that again, because those products are so drying, you've got to use it maybe once a week, things like that. And so it's nice to have other alternatives to help the skin that aren't as drying and irritating.
Okay, fantastic. And the third product, the final product, this is the squalene jelly cleanser. Now, I love K-beauty because I love the textures, and I would say that this has got like that amazing. It just again just incredible texture, non-scented. I would say out of the whole range, if I was to take away one for people that don't have acne, that would maybe like to dig into this range, this would be the product for me. You've touched on squalene and the hydration properties. What is the importance of having squalene in your beauty routine in general?
So for me, that's what I tell everybody when they have break what you so again, you want things that are going to moisturize your skin. You're looking for emollients, you're looking for moisturizers, you're looking also for occlusives. That's kind of the range of what you want to moisturize the skin. Occlusives, however, occlude, and guess what that does? It usually breaks you out.
And
And so
clogs your
that's
pores.
something, right. And so that's something you don't want when you have acne for sure. So squalene is just a really nice alternative that doesn't tend to break people out. That gives you that moisture and emollients without, again, the breakout factor. It's super important. I tell my patients all the time to look for ingredients that don't have the phthalenes and the phthalates and products that are going to be fragrance, because all of those things can tend to be irritating and cause rashes and breakouts. So finding a product, and again, that's what I love about squalene. I'm always like, I tell my patients, okay, just you're going to look for something with squalene, no fragrance. So, and now you have it.
I mean, I've been watching Instagram, and some doctors on Instagram are talking about how hyaluronic acid can actually be quite drying in some cases on the skin. Do you agree with that, or?
So hyaluronic acid is an interesting topic. Inside our skin, it moisturizes. Um, the question is it getting in the skin or is it just sitting on the skin? And it depends on the size, the molecular weight of the hyaluronic acid. So there's a lot of different factors involved. Hyaluronic acid by itself may not be moisturizing. It just may just be kind of liquidy. So
It's a
again,
very
there's no,
large molecule, isn't it? 'Cause it's
yeah,
quite hard to
there's
penetrate.
correct, correct. So penetration is hard when it comes to that.
Is squalene a smaller molecule that can get in? Yes. And also, correct me if I'm wrong, but I believe that this product, this is the squalene jelly moisturizer, has something called phytic acid in it. What is that?
So again, it's another kind of product that's going to help kind of balance the pH of the skin. And
Hmm.
so what you're doing, that's that again, that gut brain skin connection. You're trying to treat acne, but make sure that the skin pH stays in a good level and a good range so that you don't have more breakouts or irritation or things like that. So it's again a skin balancing.
Okay, and you are full of great pro tips. Do you have any specific tips on how to use this range, like just to really soup things up?
I think the biggest thing I tell my patients is whenever you use a product, a small amount goes a long way. So don't slather it all on. That's not the goal. So it's small amounts. I'll usually demonstrate on my hand and I'll put like a small amount, a little size pea, and put it on the skin. More's not better. Small amounts. Keep it simple and use it regularly. That's the other thing is compliance. So it's really important. And that's what I like when you find products that you like you said, I like the way it feels, is when people like something, they'll tend to use it. And if they don't like it, they're not going to use it. And the only way we know if these products work is consistency. So I tell people, give it a month, use it consistently, give it a month. And by that point, people are seeing some really great results.
Have you tried this on any of your patients in your clinic, and have you had any
Yes.
good feedback? What feedback have you
Yes.
had on these products from them?
Patients really enjoy the textures. That's a big part of it. They feel it's very lightweight, and people with acne oftentimes don't want heavy things on their face. I'm just waiting for them to come with a tinted version of something because the only issue we always have is we want to be able to kind of cover things up. But people just like the texture, they like the way it feels, and I've had patients say they've seen results as early as 2 weeks.
Fantastic. Okay. And this is for testing on people of all different skin tones
Oh, yeah.
and
So in my practice, I have a broad range of patients. And I like, it's one of the big things is when you're putting these products or any kind of product on darker skin types, you don't want a product that's going to leave a film or change the color of the skin. And so I gave this to a skin type 3 and a skin type 5 and a skin type 2. Those were the three patients I
okay, so
tested.
just to explain, Fitzpatrick scale 1 to 5. I would
One,
be like a 2,
you'd
I
be a one.
think.
Yeah, you'd be a one. You'd
Okay.
be a one.
Okay.
I'd be a two. And then you go 3 is typically a Hispanic background. 4 would typically be an Asian area. 5 would typically be African American. That's how it kind of breaks down. 6 will be a dark African.
Okay, great. And you have so many great tips. You were talking when we've been having a few chats backwards and forwards. Will you just share your double masking tip? Because I think that's kind of interesting as well.
So in the office, I have 2 units in the office, which are slightly stronger than the mask you can use at home. And those run 20 minutes typically.
This
And
is
so
LED light
the
treatment. Yeah.
LED. This is the LED mask or the machine
Mhm.
in our office. So when I use my mask, it automatically turns off at 10 minutes. I just push it again. So I'm getting a 20-minute session and I do it every other day. And I think that works the best with the fastest results.
Fantastic. Um, Dr. Ablon, we've already got some questions coming in. So if anyone has got questions, I can start. If you type them onto the chat, I'm going to start asking. And lovely Sarah, hi Sarah. She was asking how often should we be using the products or the LED masks to see the best results?
So, there's no perfect answer for that. Typically, we say every other day. Um, but you could use it every day. So typically I'll say to my patients, just start every other day, just it makes it a little bit easier in your routine. And the products can be used every day.
Okay, and Kat would
And
like to
oh,
know.
before I forget, I say once a day with the cleanser because I don't, when you're doing cleansers like that, that could dry you out if you use it too many times a day. You can use it up to twice a day, but I typically say your face is dirtiest in the evening after you've gone through the day and after you've had makeup on or products on, things like
Sweating.
that. So I
Yeah.
really emphasize with my patients to wash their faces in the evening. So if they
Yeah.
only do it once a day, it's in the evening, but you can then add up in the morning as well, but no more than that. And then with the squalene moisturizer, my patients sometimes will use it 2 or 3 times a day. I have no problem with that because I think it really is moisturizing and lovely.
And Kat was asking, what are your thoughts on using both the clear LED mask and the red light mask? Is that doable? Should that?
So my question would be why? Because you're
Well, I
already
guess
getting,
one for if you've got the acne, the clear, and then one for maybe the anti-aging benefits with the red, with the
so okay, so
collagen.
so you're talking about the contour. Maybe it's a different
Yes,
name.
yes, yes.
So red, when we talk about it, there's red wavelength, there's blue wavelength, and there's infrared wavelength. So the red and the blue are what is in the clear. The red and the infrared's what is in the contour.
Yeah.
So they are different. So you could alternate. I have no problem with that. Um, because you're just going to get the red and then the infrared when you're doing the others. So I have no problem with that alternating.
And then before I had this question, you were talking about eating and the gut connection with acne. What are your acne friendly foods?
So the biggest thing is what are my not acne friendly foods?
Okay.
So we don't want to do processed foods. We don't want to do sugar, especially any kind of like a natural sugar like a fruit is typically okay, but any kind of sugar otherwise, which everyone hates when I say that, but I'm like, that's just the reality. And anything with a high glycemic index, anything that's fried, any kind of cured meats, alcohol is on that list. So those are some of the main things that I try to get people to avoid
So all the
because,
fun stuff, basically.
you gotta find other fun stuff. That's the whole point.
Yeah,
Gotta
yeah.
be other fun stuff to do.
Hmm.
But when you eat those kind of foods, most of them go to sugar. And so you're creating that high level of sugar, high glycemic index, and it can break you out for sure.
And someone, I think I don't, sorry, I can't see the name. It just says Zoom user, but has asked if her 13 to 14-year-old teens with congestion can use these products. I mean, I'm in the same boat because my girls are using Drunk Elephant, Glossier. I mean, they picked up a retinol product the other day because they thought it had nice packaging. Is this good for congested teen skin?
It is good. Sometimes you need to get them cleaned out. That's the only issue. It just depends on how bad it is. But you could certainly start with that. And if they're doing well on it, they're great. If not, then I would get a clean out to extract some of those deeper cysts.
Great. And I mean, there are lots of different types of acne. This range, will it work on everything from sort of cystic acne to, other types of acne?
So it helps all types of acne. And as you heard earlier, the idea is that it's not just teenage acne. Those hormones that I mentioned, which is the fourth main cause of acne, um, continues as we get older. And when our stress is off, our hormones are off, and that can us out as well. So you're seeing a lot of people on TikTok, on Instagram saying, I'm in my 30s and I have breakouts, or I never had acne as a kid and now I have acne in my 40s. So it is really this continuum. So it can be used on any skin type. Will it treat all acne? Probably not. It's not going to treat a severely cystic, scarring acne, but it certainly could help it. And so the idea is that it's a nice first line of treatment that you can easily get and see how that helps. But when patients come in for with acne for me, and again, depends on the level. So we've got mild, moderate, and severe acne. That's how it's kind of graded, is that, I may be more aggressive, especially if I'm seeing scarring. So if you've got a kid at home and you're starting to notice scars on their face, I would get them in to see someone, because the last thing you want to do, as I mentioned, is acne sequelae are very difficult, and the acne scarring can be very traumatic. And there's a really big psychosocial aspect of acne. And it's important, I think, with your teenagers is to talk to them, because I'll get teenagers in here with their parents and they're sitting in the chair and the parents are complaining and all this. And I look at them and I say, does the acne bother you? And they go, no. And I'm like, well, they're not going to use anything if it doesn't bother them. So it's
Yeah.
important to understand your audience. And so if you talk with your kids and they're like, you know what, I've had my children will say, I'm not going to school because I have a pimple on my forehead. And I'm like, that is not an option. You're going to school. So again, first line treatment, nice option to try. And if they do well on it, you're saved. If they're still breaking out, might be something that you want to get a little bit more aggressive.
As someone who personally suffered from acne in my early 20s, I ended up going on a course of Roaccutane, or Accutane as it's called sometimes. Um, I have a business called The Editor's List where people come and ask me all sorts of questions and want to get directed to different cosmetic doctors. And one of the biggest questions, especially from women who have teenagers, is, what's my opinion on Roaccutane? As a dermatologist, what's your opinion on Roaccutane? And could you
So,
use that? Could you use this LED mask while you're doing a course of something quite sort of strong, like a
so
Roaccutane
yes.
treatment?
So number one, you absolutely can use your LED mask with Accutane. That is not an issue. Okay. Roaccutane or Accutane or all the different versions of it, but isotretinoin, which is what the ingredient is for all of the vitamin A, the strong products, is a wonderful medication. It was designed for severe cystic acne. It is used across the board for mild, moderate to severe acne. People think it's the end all be all, it's going to cure everything. Here's the problem, and I see it in my practice. Number one, I don't like to give it for teenagers because it can actually stunt your growth. So it does prevent the epithelial plate from growing. So for people that, especially my 15-year-old boys that want to be 6'3", if I give it to them too early, I could actually make them not grow as much as they would otherwise. And same with the girls. So I always go over that factor. Number two, because hormones are a very big part of acne, and Accutane does not address that aspect whatsoever. And so if you give it and there's a very big hormonal component, they'll clear with that isotretinoin, and then they'll break out again because you haven't addressed one of the main causes of that person's acne. So I reserve it for my severe acne, my resistant acne, my acne that's got severe acne with scarring. That's where I will jump to that medication. But frequently, I've already tried other things and failed before I will go to Roaccutane or isotretinoin. So I think it's really important to understand how the medicine works. There are side effects. You have to go through this. And like I have consents, and I just had a patient in the other day who was never given an instruction sheet and gone over like all the side effects of that medication. And she did great, and she broke out again, and she has scarring. And so it's now, we're kind of behind the eight ball because she's already done that Accutane. Now do we do another course? But a lot of it's hormonal, so we're actually going down a different route for her. So I think it's really important to, again, know your acne, know your patients, go over all the complications that can go with it, because you have to not only epithelial plate problems, they can have hair loss, they can feel like they have the flu for the entire time that they're on the medication. So there are side effects with that drug. It's an amazing drug when used in the correct way.
That is, I never knew that, so I'm so grateful. And I want to say hi to Ate because she's got teenage girls who are friends with my teenage girls, so we're kind of all in this together. She was asking the question earlier. Erica is asking, she saw an offer from Omnilux with a face mask, a topical face mask to be used under an LED mask. Do you recommend this? And
Which,
how often?
say it again,
Would you
spell what?
use like a topical face mask under one of the Omnilux LED masks?
Why?
Um, I don't know, maybe better penetration,
I,
double masking.
yeah, I typically just like the mask by itself. I think it works great. And so I like to just get all of the LEDs and not have them blocked by any kind of other physical item.
It was a hydrogel face mask that they were
Well,
recommending to
the
use.
issue is with again, because you're putting a moisturizer on there, these products are allowed to be used before you put the mask on. It really just depends, and that's where I would want to know all the ingredients and all that. Is this blocking anything? Is this gel, does it have any kind of properties that could make the light not penetrate as well? Those would be my questions. And if they haven't studied it with a mask, then I would be concerned.
Okay, so Erica, just I think what they're saying today is with the Omnilux Clear, just to use this noni balancing serum underneath, and
And
then
that's
you
what,
apply the moisturizer after you've done the mask.
correct.
Um, Someone was asking me the other day, and I'd like to ask you, with LED masks, do you have to have skin to skin contact? Is that the best thing? You actually have to have the light on top of the skin, or should it be?
You don't, when you put the masks on, they
Yeah.
kind of sit on your skin, but
Yeah.
when we're doing it in an office, as long as it's within like an inch of the face, you're fine. So you
And any
could
concerns
theoretically hold.
about eyes, damaging your, you
Well,
know,
anytime you're doing anything, you obviously want to protect your eyes. The nice thing with the mask that they have is they created that little slot, so it kind of creates a protection around the eyes so that you're not getting the light in your eyes the way they designed that mask. And that's the other thing is that, there are a lot of mimickers out there providing you with these things that don't protect your eyes. So I do like to protect the eyes. When they're done in the office, I actually put goggles on.
Okay, great. Does anyone have any more questions to ask Dr. Ablon? Well, we've got her. I mean, she is a world-renowned dermatologist. And any acne questions or how to use these products? I just have to say that I'm definitely going to be putting these in my kids' bathroom uh, and recommending to friends. I think I'm kind of through the menopause now, but I do know that perimenopausal skin can be incredibly challenging. Are you seeing an increase in women with perimenopause acne issues?
Well, I think it's not that necessary that we're seeing more issues. People are going into menopause earlier. We have a lot of chemicals in our food and in different kinds of ingredients and things that we are in our everyday world. So I think our hormones are really getting messed up and pushing us into menopause in a much earlier stage. And what's important to understand with menopause is that you, with as you go through menopause, the estrogen goes like this. It drops off very, very quickly. So you actually live in this androgen excess world, and that can break you out. That can lead to hair loss. That can lead to dry skin. And so it's all these wonderful things that you get to go through. And I'm going through it right now at 59. It's it's a very it's hard on your body. And so as that change happens and as the hormones get all messed up, breakouts are very common. And I think we are again seeing people go into menopause earlier. We have a larger population, so there are just more people in general. And I think we're also being more aware now of it. I was at this conference with Naomi Watts called the Pause, I think it was, and she's doing that thing with Oprah now. And people are really talking about it more. I think, in nature, we lose our estrogen, we can't have babies, and we die. I mean, but now we're feeling our best selves in our 50s and 60s and 70s and 80s. And if you can create a time where your body feels good, your skin looks good, you're usually happier. And that's where, again, balancing the hormones, figuring out nutrition, all of those play a big part. And acne is just part of it. And so if you can have simple things that you can do at home, great.
Bring on the self-care, I say. And this is such a great range. I mean, again, just for working women, for people on the go, it's super simple. I would say this would be great for men because it's non-fragranced. I mean, the packaging is phenomenal. Looks very chic, I think, on the countertop. Um, and love that you can use it in combination with the LED mask. Well, it's been so insightful. I've learned so much. I will not be putting my children on Roaccutane. Um, you'll be watching the diet more. And yeah, thank you for sharing some of your amazing insights. Just to repeat that June is Acne Awareness Month. If anyone's doing any features and would like to speak to Dr. Ablon, if you can contact the Little Light PR team, and they will put you in direct contact with her for direct quotes about the range. I think everyone is being sent the full trio. Even if you don't have, breakouts or acne prone skin, I would definitely try them because I have really enjoyed using them and I will continue to use them. But thank you all so much. I'm just double checking uh, if anyone has asked more questions. Um, could you, just before we go, Alice would say, Dr. Ablon, please can you do a roundup of the steps, including the LED mask, as she missed the start of the meeting?
So stepwise, again, my most important thing is cleansing at night. So I'm not so worried if you wake up in the morning, you're ready to go, you can do your noni, you can then you apply your noni and you can apply your squalene and you can put your sunscreen on and you're good to go. It really just depends on when during the day you like to do your mask. For me, it's at night when I'm bustling around or when I'm cooking, things like that, because I put my little charger thing in the
Quicker.
pocket
Yep.
and I'm good to go. And so, or you can again cleanse noni and do your squalene moisturizer and then go about your day. If you're going to do your mask in the morning, you would cleanse noni and mask and then put your
So
moisturizer
cleanse,
after.
noni serum,
Right. And then
mask, and then number three is the moisturizer afterwards because LED can sometimes be a little bit drying.
and always remember the really important, whatever you're doing in the morning, if you can get your kids to wear a nicotinamide based sunscreen, is a great idea because you do want to protect their skin. They'll thank you 20 years from now. And the nicotinamide helps reduce breakouts like they put in other ingredients.
That's another great tip. Thank you so much. You're full of them. Anyway, I will let you get back to your busy Californian clinic. And thank you so much for everyone. I know how busy everyone's schedules are. Thank you very much for joining us today. And we really look forward to you experiencing this amazing new range from Omnilux. Thank
Hi,
you.
everybody.
Bye-bye.
Great
Thank
evening.
you. See you.
Bye.
Yeah.
Bye.
Thank you so much. Bye.
Bye.
Thank you so much. Very, very grateful.
Oh, thank you.
Can I quickly ask,
Yes.
if you've got combination skin types, you've been working with someone with dual skin types, maybe dry and oily, that's prone to breakouts, is it safe to use and treat the whole skin type altogether, or is it better to treat them separately?
No, I say treat it all because again, it's going to kind of go where you need it.
Perfect.
So you'll be fine. I would absolutely do it all.
Perfect. And it's better to use the clear mask with the blue lights rather than the red.
Correct. Correct.
Right.
Well, remember, the clear mask has red and blue.
Oh, really?
Mask
Fantastic.
has red and blue.
Okay.
The contour mask has red and infrared.
Okay, cool. Fantastic. Thank you so much. Really so interesting. Very grateful to hear.
Good.
Thank you. Thanks, everyone.
I think we're down to, we've got about 10 people on here. If anyone wants to ask a more personal question to Dr. Ablon, now is your chance. Anyone? I might just sign off the meeting then.
Can I
Okay.
ask one question if I'm going
Yeah.
to take that minute? If you've got one real mega zit standalone zit, which is a horrible question to ask, but I thought I'm going to ask it. If you have someone that's like got painful acne, what product would you put onto that out of your range, like as an intensive treatment to kind of treat that standalone?
The noni for sure.
Okay, cool.
Yeah.
Excellent.
And a warm compress.
Okay, great. And the noni, what is the kind of, I know you've got lots of inflammatories in that. It doesn't dry the skin too much. It's all good. Amazing.
I've got a
Very
question. If you do have that awful one zit, do you still do hydrocortisone injections in clinic? Just to sort of like, I've always told if someone is a bride and let's say they have a breakout on their nose before their wedding, you can get a little hydrocortisone injection.
We
interesting.
actually work on a movie studio lot here. So I'm on the movie studio lot. And so we get a lot of the celebrities will come running in because they have something on their face. So
But
yeah,
you have to know what you're doing, because if you inject too much hydrocortisone, you can indent the skin temporarily, right?
yes,
So good. And it works well under makeup, the range?
yes.
I love it. I love it. It layers, like you can put your sunscreen on top, your foundation on top. It just sinks into the skin. It's glowy. It's lovely.
Right.
Rose, do you have a question? Yeah. No. I've just
I'm
got,
just generally listening in. I find it really interesting because I've only just started using the full mask, and I
Mhm.
can really see a difference in my skin. I've got rosacea.
Mm.
But to be honest, Olivia, I was working backwards on you because I was thinking, how have you come out the other side of your perimenopause? I was just thinking you look like you're in your early 30s.
Oh, you're so kind. I'm 51 in May next month, and
You look
I,
incredible.
that's so nice of you to say
You can
that.
tell that's where my mind was going. That's what the card I was
Oh,
thinking, how has this lady gone through the perimenopause?
I think I've gone through it. Yeah, it's been a while.
Right.
But I am an advocate of not going in the sun. I
Yeah.
had terrible skin when I was younger. I had to do, when in my early 20s, I did two courses of Roaccutane. I
Mm.
personally feel that the high dose of vitamin A not only cleared up my cystic acne, but I feel that it's kind of given me some kind of anti-aging kick. I don't know, Dr. Ablon, what do you think? I just have this feeling about that. Um,
That
I
would be your
do.
feeling.
I am a big advocate of LED masks. I definitely, like you, when I use them, you can instantly see there's like brightness in the skin.
Yeah.
And I love a good moisturizer. And I have, because I've been presenting this, I have been diligently using the products because otherwise I couldn't speak about them. And this squalene jelly moisturizer is my favorite of the range, which I really like. But thank you so much. That's such a nice thing to say. I'm very chuffed with that compliment. Thank you.
But it's so true. Like you look really fresh. There is a
Oh, thank
real
you.
freshness to you.
Thank
But
you. That's
this,
very
the whole
kind.
thing has been really interesting for me because I speak about rosacea and redness a lot. There's such a crossover when people are trying to work out, is it acne rosacea or just acne? Um,
Hmm.
and so I took away a lot of kind of things for that conversation, really.
Great. Well, Dr. Ablon's skin is also unbelievable, as is her
I
hair.
know.
But I think
Perfect advocate for
Californians
all of
are
this,
so
yeah.
polished. They look great, and their teeth are also great. They have it all going on. Um, yeah, any other, I mean, so yes, I mean, I'm a rosacea sufferer, so the clear for me as well, just the taking down the anti-inflammatory side, 'cause I sometimes do get the little pustules.
Yeah, me
I
too.
think it's a good little hack for those, definitely. Um, have we got anyone else that needs to ask Dr. Ablon anything? We might as well utilize her as much as we can.
Right. If no one else, just some feedback. I haven't got the clear mask, but I've got the contour one, and I burnt my hand. I didn't realize how severely, but quite severely, to the point when I went on a few jobs as a makeup artist. I had the medics come up to me and say you should have gone to A&E, and like when I went to people,
Or your hand with
people would
the
say it was bad, but I used the contour on it every night, and I've hardly got anything. I mean, I've got photos to show you. It shows a little bit of redness still. I'm still using it, but it's completely healed my hand. It's like a miracle.
Oh, right. So you had a burn. Did you put, like, was it hot water
Yeah,
or was
water. I was filling up a hot water bottle just before Christmas.
poor you? That's awful.
Yeah, well, yeah. I
That's
mean,
amazing. Well, that's great
yeah,
feedback.
the results is was and I have a lot of people when I've posted it on Instagram, people are like, oh, does it work? I have that quite a lot as feedback, and I'm just like, look, all I can say is this is what happened to me, and show them the results on my hand, because that's a really good visual, and it really was. Look, that's my
Wow. I think Omnilux need to repost that. That's very powerful testimonial. That's incredible.
yeah,
Well,
no,
Thank you for sharing that.
nice.
we use our masks after any kind of procedure, any kind of different kinds of
Yeah,
lasers like that, because again, it does help with healing, bring down
healing,
inflammation.
yeah,
So it really
yeah.
is amazing.
I'm going to have microneedling tomorrow, so I'll do the mask as well and I'll report back on that.
Yeah, brilliant.
Yeah, great.
Ah, I'm looking forward to trying the range.
Like, I mean, honestly, it's really good. It's really good. You can see they've been working hard on this. There's so much stuff out there. This is something that I would definitely have and return to. I think sometimes, as a beauty editor, when you're trying lots of different things, you can get these breakouts just because maybe you've used a combination that hasn't really agreed. So I would say that this trio would be a really good range to return to just to calm things down and to get your
Mm.
pH and your barrier going, a bit more balanced. What do you think, Dr. Ablon?
Absolutely. Again, because
Mm.
Yeah,
it's
Mm.
mild, it's not irritating. I
Mm.
think it's a great, great idea.
That's
yeah,
fantastic. I totally agree on we're blessed to be sent all these amazing products, but my skin, like yours, it can break out from having too much use of different things. So yeah, I am trying to slow it down a little bit, but also try and give feedback to everyone that comes to me. So that's awesome. Thank you so much. Very grateful.
great. Thank you. Anyone else? Just keeping it open. Okay. Well, thank you, everyone. I will close the chat now, and thank you so much for joining. And yeah, please be in touch with the lovely team at Little Light who will put you in direct contact with Dr. Ablon, and hope this inspires lots of great articles. Thank you.
Thanks so much,
Okay.
everyone.
Take
Thank you.
care.
Thank
Bye.
you.
Bye.
Bye
Have
bye.
a good day. Thank you so much. I'm very, very grateful. Bye bye.
Bye. Okay, bye bye.
Thank you, guys.
Bye.